to talk to you about your new handheld, the GlideScope Go.
Sorry, I should introduce you. Sorry, I didn't know you were ready. So,
Oh, yeah.
Sigurd's the rep from Marathon. Of course, nice enough to provide us all these new GlideScopes. Go ahead.
Okay, so have you guys seen the GlideScopes at the hospitals, I'm sure? So the great thing about this handheld is that this works with the exact same blades that they're using at the hospitals and the emergency departments. This handheld, super easy to use. There's literally just an on-off button here. Press that button, takes a couple seconds to wake up, and you just have this connection here. It's an HDMI connection that you plug the blade into. So this is a completely disposable blade. You click it in there, and then you're good to go. This right here is your battery life. At full charge, it'll have 2.5 hours of battery life, and you can see this ticking down here. It's an hour and 19 minutes left on here. This does have recording function as well. It comes with a micro USB that when you plug it in, when it's plugged in, I'm not sure what your practice is going to be, but if you leave it in there all the time, when you plug the blade in, it starts recording, and then when you release it, it stops recording. The monitor head here will swivel, and so you can, depending on the lighting around you, you can adjust as needed. And also, if you have somebody with a big barrel chest, you can put this out of the way, go in there, and then release it back. So the nice thing with these blades too, this is our classic, our GlideScope curve here. These low pro, we call them our low pro blades. Here's a 3 and the 4. They're really versatile with who you're going to use these patients on because of this length here. You can adjust how deep you're going. I've seen this 4 used on a 115-pound patient, and I've also seen it used on a large obese male, and it's worked just fine. The view that you're getting with this is going to be more of it's a wide angle view, where what you're looking for is really the glottis is going to be up here, kind of this top middle third of the monitor, and that's going to make it easiest to get the stylet and the tube where you need it to go. This same monitor will take adult and pediatric blades, so you just and they all work the same way with just plugging in the back. With using these blades here, another nice feature is that you don't have to put the patient into the sniffing position. You keep them at neutral, so if you've got somebody with an injury or in a C-collar, with limited mobility, you can keep them in that neutral position. And it really, when you're playing with the dummies, they're really hard and rigid, and it feels like it takes more force, but on a patient, it really just takes 2 to 3 pounds of lift. So, you guys have any questions for me? We're gonna get you guys to come up here and use these and see what it feels like also.
Yeah, I'll walk through the technique once.
Okay, yeah, absolutely.
We have stylet there.
Yeah.
So great, cool thing about the GlideScope, right, is that as Sigurd said, this is the exact same blade that the ORs, emergency departments use. There are different blades you can get for the GlideScope, but this is really a nice low-profile blade called the Spectrum Low Pro blades. And the pediatric sizes, the size 1 actually can go all the way down to 3.5 pounds. I think just a little bit less than 3.5 pounds. The size 2 blade ups somewhat from there. The 3 actually goes all the way down to, you can do 20 kilos, I think, up to almost adult size. And I will occasionally use this 3 blade on smaller adults. And but generally the go-to blade is the size 4 for most adult patients. One thing for sure that you'll notice is how slim the blade on the Low Pro is. And you can imagine that you can get through a fairly tight mouth opening. It requires very little manipulation of the patient's jaw or airway. It is a very different technique than using a Miller or a Mac blade, in that when you have your Miller or Mac blade, you're really kind of having to lift the patient's jaw forward to gain access to the glottis and a good view. With the GlideScope, this is much more about just, really, it's about following the base of the tongue down to a good view in the vocal cords. So when you do this, it is important to know that you definitely you need to use the GlideScope stylet that comes with it. Now for pediatrics, it's a little bit different. It's a smaller plastic, more malleable tube that you can adjust. But for the adult, you do want to use the GlideScope stylet. And the reason for that, and you don't want to go monkeying around and bending it. That's one of the issues I think people run into. Is that the shape of the shape of the GlideScope stylet is really meant to accommodate the shape of the hook of the blade. So once you insert the stylet, this stylet shape really helps you to guide the endotracheal tube into the right spot of the glottis. So you simply would load the stylet just like you would any other intubation. You'd have your 10 cc syringe ready, your end-tidal CO2. Patient's ready to be intubated. First thing you want to do is you want to get your GlideScope. You gotta get your GlideScope set up. It's very simple, just like connecting the HDMI cable to the back of your DVD. Turn it on, there's one button on the top. Insert it, and boom, you've got your connection. Gonna do the procedure. Your patient's probably gonna be, if they're not immobilized, you're gonna move them to the typical kind of intubation position, sniffing type position. And then to perform the intubation, recommend first that you open the patient's mouth, and that you look in the patient's mouth as you guide the GlideScope down along the base of the tongue. Can you all see over there? Thank you. Again, I'm just guiding this down the tongue. And once you get the blade into the back of the mouth, then you start, as you're kind of passing the uvula, you're gonna start looking at the video screen. As you look at the video screen here, you use that as a way to.
This guy's
got all-
kind of falling apart.
Okay, I was gonna say,
That's what
the anatomy seems slightly unusual. So you're gonna guide this all the way down in.
And it
Sorry.
really feels like you're using a lot of lift with this guy.
Yeah.
You want to use one of yours here?
I got a good view.
Okay.
And then, so you're gonna get a view of the vocal cords, and I'm sorry I have to pry a little bit just because of the dummy here part, but what you get is this view of the vocal cords appear in roughly the middle upper 1/3 of the screen, and that's the position you want it in. The goal is not to have the vocal cords right in the middle. The vocal cords actually should be in the upper 1/3. And you kind of get a view like that. Can you see that okay? All right. You see that all right? Still got a somewhat decent view there. Once you're into that position, you're now going to take your attention off of the GlideScope screen and hopefully have a partner. You'll have a partner with you. And the next step is you're going to look in the mouth as you insert the endotracheal tube, and you're going to do that just basically following the shape of the GlideScope stylet. And as you do that, you'll start to develop this nice view going down into the vocal cords here.
It's a little sticky.
What you get, as you'll see here, your endotracheal tube will start to approach the vocal cords here. So you got your endotracheal tube kind of starting to approach the vocal cords. And just like you would any other intubation, you really should have a very nice view of the cords. That's right. There you go. You guys see that okay? And then with the stylet, you can guide it using your thumb. If you need to be a little more anterior, you can withdraw, and you just kind of, it's not really a manipulation so much of the tube as much as you can kind of use in practice, using this to learn to kind of guide the endotracheal tube, just using some soft manipulation.
And when you sorry to interrupt,
Yeah.
when you push up on the blue tab here, it actually will manipulate the end of that tube.
Right, so when I get there, I'm kind of just right at the posterior area of the vocal cords, and then I will just lift up slightly, pulling the stylet out, and the endotracheal tube will move slightly anteriorly, allowing me to intubate the cords here.
And that's when the second person helps. As you're advancing the tube in, the second person will be releasing the stylet, and it's really important to release the stylet in a rainbow fashion towards the patient's feet, because you, obviously with that curve there, you don't
And
wanna.
of course, you advance the tube to the right position. Pediatrics, a very similar situation. Again, hopefully we don't have to do too many pediatric intubations, but if you ever do need to, certainly having a video laryngoscope is very advantageous. And that is about it. So yeah, once we have this fully set up, it'll be it should be able to record anytime that you turn it on. It will begin recording. No, there is no audio recording. Just in case anyone's wondering, you only get to see what you can see. And that's about it. So it's a nice tool to aid in the airway intubation procedure for us.
And for cleaning, this is totally low-level disinfectant because these blades are disposable. So in between uses, you'll just wipe that monitor down with the gray sandy wipe in between uses.
Gray?
Mhm.
It's purple.
Okay, so ours is purple, okay. All right, 'cause we don't have gray, that's what it's red. Okay.
You want them to go ahead and?
Yeah, so I think we'll just kind of do this in a couple of groups. I'm happy to do the pediatrics over here, and then Sigrid will run people through the adults. I think probably use our adult trainers.
Yeah,
The
kind
one-
of makes it a little harder.
I think that one there on that end and the one in the box are in better shape. And then baby wise, these two might be better than those, at least especially on the tongue.
But when do you expect the GlideScope to arrive on the units? Would be probably sometime here in January, is my understanding. We have all the GlideScopes. I believe we just getting blades, stylets, and everybody the opportunity to look and use them before we move forward.
I think this might be.
Does it matter if you cut it on before or after you attach the blade?
It doesn't matter.
Doesn't matter, okay.
And the nice thing with this too is that you can hot swap it, meaning if you decide you want to use a different blade,
Right.
you can, while it's on, you can swap them out.
And with the recording, just, I didn't know. Okay.
I'm not sure who's gonna do it now.
Is this thing missing something?
That looks like our regular,
Quite possibly.
it looks like our old, I guess you could set the depth of these.
I know, but you.
I know, it's not, kinda hard to do that when the whole thing is flat out.
The stylet, we use our tubes with that stylet.
Correct.
Okay, so that doesn't come as a package.
Just
No.
Okay, all right.
Right.
The first one I grabbed was beating to the
So anytime you're putting any,
I'm like,
you
nah,
want
it
you to
could be.
get enough.
One of them, the tongue was a little torn, but yeah.
That's a new one. I pulled this one over there.
So this part is disposable.
Right, yes, that's correct. They're a one-use disposable blade for one patient.
How do we, is this, just wipe it off with like purple cloth?
And it helps, I sometimes go with just a little bit left, like a hair left in midline, just to give you a little bit more room to touch that tube.
Blue right there.
So the stylets, are those disposable as well, or are those gonna be?
Here, let's pull out.
So I would, yeah, I
Maybe
would
it's too big of a tube.
put that
too.
tube in a little bit more before you start to
That's
release
not
it.
what I believe is disposed.
There you go.
Can I see that way over?
Metal
And
ones
then you've got your
are
second, so
clean.
you can get your second pair of hands.
The stylet has to
It's pretty stiff.
Yeah, the stylus.
Yeah, there you go.
but they have to go to.
Anyway, the reason I was asking.
It's just that rubber on
is
rubber,
usually-
it's like you got in there.
Usually not.
The actual.
No.
I'm bound to get one look at it. You go in and see a opening, but throw it in there. Yes.
What do you think?
So is there a particular?
Pretty easy?
Well, not really. Although what I would tell you is that if you do hold it, you kind of want to hold it like this with your thumb up, but don't push up. If you push up too hard, you'll disconnect the connector, right? So it's not made, and then GlideScope's really not designed for a lot of lifting. Mostly it should. You shouldn't really have to do much. If any force is just a very small amount.
Yeah, so it's easier to touch.
Slide very well.
John? This is very well handled.
Well, actually, we're
I mean,
having a good view.
I was able to visualize this one easily, very easily.
Weird when you look on the screen, find the cord, stick between the cord and all at the hospital.
means you have partnered this through.
It's like, that's what I'm saying, the tubes on this big.
I didn't. Yeah.
I mean, just, man, it just goes to.
No, you talked about it and I saw something on there.
I'll try to.
Yeah, we allowed, well, actually, we allowed you on the, last time, but that's,
Are you able to dislodge that when you're throwing what you do really don't, or not?
It really does kinda take two people.
technically, but no, it's, I mean, you really do wanna have a second person helping you withdraw it.
Yeah, it's
That is a little bit harder, cause it wants to pull the tube out.